Hey, Jen.
Hey, Dana. Hi, everyone.
Welcome to Hypnosis.
And beyond. Today we have Garry Coles. He's an internationally sought after hypno-oncology specialist, researcher, and speaker.
Hey, Gary.
Hi, Gary.
Hi.
Thank you so much for joining us today. We are so excited to get to hear more about you. And please just jump right in.
Me. Yeah, well, I'm joining you from sort of a slightly stormy summer's afternoon from the UK. You can probably spot I'm not American from the accent. I'm from across the pond, not far from London, and I've been a full-time hypnotherapist for over 20 years now. And my specialism is hypno-oncology, and that's hypnotic interventions for the cancer journey.
Wow. I'm sure that you've told the story so many times, but for people who don't know, could you share a little bit about how you found that specialty or did it find you?
It found me. Even hypnotherapy found me, strangely enough. I must admit, I come from a very scientific background. My original sort of studies was maths and computer science, and I was an IT consultant in the oil industry. And then I made this obvious move to hypnotherapy in oncology.
Logical.
Yeah, no, what it was just really bizarre. Because of consolidation in the industry, I found myself out of work, but I saw it coming, so I insured against being made redundant. So I was in a position where I didn't need to work for a couple of years. Had no idea what I wanted to do. Christmas was coming, so I built a web store and was selling books. Christmas came and went, and I thought, what do I sell in January? And out of the blue, somebody offered me a job lot of hypnosis CDs for things like weight loss, quit smoking, sleep and anxiety, and I was surprised how well they sold. And I had some books on it, and I thought I didn't realise it was this popular. And I also thought, well, I'm not even sure I believe in it. But I happened to see a doctor of psychology locally offering an introductory course. And I thought, oh, I think it's a load of old rubbish, but I'll go along and have a look, see what it's about. And I went along, and I was still skeptical. I was seeing people being hypnotized, but what I didn't realize at the time is I'm aphantasic. I can't visualize. And so I just thought it was hypnosis didn't work rather than me not working in the way that it does with other people. And so one of the things that he said on this course is I'm going to work with an issue with everyone to show you the power. And he said, what would you like me to work with? And I said, well, actually, I haven't really got any issues. I said, but there was one, I suppose, if you want to find something, I said, but to me it was normal, was I used to suffer from nightmares ever since I was a kid. About 4 nights a week, I would wake up shouting, kicking, punching, or whatever. I'd think, oh yeah, that's a nightmare. I'd turn over and go back to sleep again. So that was absolutely fine, really. It was just normal. And he said, oh, we'll work on that. And we spent a whole afternoon, and he explained to me all the things that would happen. You're going to visualize this. You're going to use idiomotor responses, and this will happen. This will happen. That'll happen. None of it did. And I was even more skeptical because he said at the end, well, what do you think? And I said, I was just keeping my eyes shut out of respect for who you are and what you were trying to do. But I said, I was skeptical. Now I'm even more skeptical. So I said, everything you said would happen didn't. And he said, okay, just see how it goes. And so I thought, load of old rubbish, and went home. And I was sitting at home probably 4 or 5 weeks later, and I suddenly dawned on me I hadn't had a nightmare since that session. So I thought there's got to be something in this. I thought I'd go and investigate it a little bit more. So I went and did a basic sort of diploma in hypnosis and hypnotherapy. Uh, then I thought, okay, yeah, perhaps I'll do this part time. And then, totally out of the blue, I had a phone call from a hospital saying somebody's just told us that you've qualified as a hypnotherapist. We used to have one here, and they've just left. Would you like to come and sort of give us some time and work with some cancer patients? And at the time, I was thinking, I was feeling a little bit mercenary, thinking, yeah, I need some experience. And so I'll just go along there for a couple of weeks. I'll see 8 patients a day. I'll get experience, and I'll disappear. Didn't quite go according to plan. I'm not still there now because I'm too busy, but it did take me nearly 20 years to not be there. So I worked probably with several thousand cancer patients, so I know what works, what doesn't work, develop techniques and approaches. And then I was offered the chance to study for a master's degree, Master of Science degree in clinical hypnotherapy, the first cohort in the UK. and I decided to make it really difficult for myself. I thought, yeah, let's do medical research. You know, why not? Everybody told me I was mad, and looking back on it, I probably was. But I persevered, and I ended up doing a pioneering piece of research. I did a study into pre-surgical hypnosis and the effects that had on the recovery quality in breast cancer operations, and I was able to demonstrate it did, and how and why. And it wasn't due to my research, but it's interesting now that the Royal College of Anaesthetists in the UK now actually recommend pre-surgical hypnosis. They don't call it that, but that is what it is. So it's nice that it's now being recognised to do that sort of thing. Then my research got out. Then I started getting lots of emails saying, well, you're a bit of an expert, can you give me some advice? And then I did a couple of podcast interviews, so I was getting more emails. And then a few people said, need to put a training course together, teach doctors and psychologists and other hypnotherapists how to work with cancer patients. And at that time I thought nobody's going to be interested. And then I got invited to attend the first UK hypnosis convention, and I've done every one since. And then I was asked to come to the States and present, which I now do regularly as well. And I gave up, and I put a training course together, and I now train doctors in Belgium, psychologists in Bahrain. I've just come back from teaching nurses in Iceland. So it's sort of taken on a life of its own, really.
Wow. So when you say you're training doctors and nurses, could you give us an idea of what are you teaching them hypnosis? Are you teaching
Yeah, well, I'm teaching them hypnosis, but specifically teaching them techniques to work with people going through the cancer journey. Because the one thing we don't do, and against in the UK, it's against the law anyway. We have a 1939 Cancer Act. So the Cancer Act says it's illegal in the UK to advise on cancer treatment, to treat cancer, to offer a cure, remedy, or anything else. But you can work with the patient going through it. So the work we do is for the whole journey. So I would work with people from the psychological fallout of diagnosis. So you have all the fear, the panic, and so on. Then we deal perhaps with fears and phobias. They might be frightened of needles, scanners, that type of thing. Then pre and post surgical work. The biggest area I probably actually work with is side effects of treatment, things like nausea, taste changes, all that sort of thing. Pain control, that we know hypnosis is very good for. That's the biggest complementary therapy researched area for pain control is hypnosis. Then we do sort of work, if you like, palliative care. And so on, and then sort of even sort of beyond the cancer, what happens with the life changes afterwards. So I teach the whole of the way through that, how people can work with cancer patients and give them something for each part of that journey. So that's what I do with the doctors, the nurses, and other hypnotherapists.
That's so interesting. Then do you work with alternative practitioners that treat cancer, or is it mostly the sort of what I suppose Western medicine considers the
Uh,
traditional, you
Yes,
know?
it was that way. The hospital that I was based at had a small complementary therapy centre, but it was still administered by the NHS in the UK, and it was within the oncology unit at the hospital. So I was working with the oncologists, the surgeons, and the doctors. And in fact, one of the greatest things I had was when I was doing my research. Ethics was a major issue. Trying to get my ethics approved, I had to go through the NHS ethics committee. I had to go through the university ethics committee, and because it was the first cohort in a master's degree, they panicked like mad that I wanted to work with cancer patients with hypnosis. Then I did the NHS, then I had to have hospital research and development, then I had to have the surgeon teaching team, and that was the hardest one. I saw the head surgeon, and they said, right, she's going to interview you. It's her say whether it's yes or no. If she says yes, you can do it. If she says no, that's it. And she gave me a really hard time, and I thought, looking back on it, she was just trying to prove that I wasn't going to waste time, that that it was going to be a valid piece of research. And eventually she said, "Yep, okay, we'll do it. You can do your research." And I thought the greatest part of it was she was the teaching surgeon, and it was about 8 or 9 months into my research, and she came up to me one day and she said, "We're seeing the results that it's having with the patients." And she said, "I think we're starting to guess which ones it's going to work best with." And she said, "If you'd like me to change my elective list around to accommodate you, just come and see me and I'll move it around." And I thought, if we got the head surgeon moving their patient list around to accommodate the hypnotherapist, they're obviously seeing some really good changes.
Wow. And are you seeing any of your research or this openness to hypnotherapy as a treatment modality for patients. Are you seeing it in any other areas of medicine in the UK? Or I know you're very specialized, but are
Yeah,
you know?
there are. I mean, one of certainly cancer treatment or working with cancer patients is becoming more common in hospitals in the UK. One of the things that the NHS recommend, we have an organisation called NICE in the UK, National Institute of Clinical Excellence, and they're the overseeing body approving the treatments that the NHS can use with patients. And one of the things that they recommend now for irritable bowel syndrome, then their number one go-to is hypnotherapy. So there are a few other medical areas that the research is there,
Wow.
that it's now being pushed into. So it is good from that point of view. It's becoming more accepted. And another area I research in, which when I mentioned, obviously we're not allowed to work with the cancer itself. Now I do get, and we do see spontaneous remissions and things. There's been lots of stories about that, but we cannot prove it. The evidence base scientifically is not there. And I do get patients come to me and say, oh, can you do some work for killing the cancer or working with the immune system and things? And I said, well, experimentally we can. Technically we're not allowed to, but as long as it's done for your well-being of your mind, if you like, psychological well-being, yes, we can do anything if it's experimental. And one of the areas that I do some work in, and I've done a lot of research in, it's a bit of a mouthful, psychoneuroimmunology. It's the study of how feelings and emotions affect the immune system. And again, there's a lot of scientific evidence behind it showing that it does, and it can. There's been lots of tests done, blood tests and other things. So if we take that to the full circle, if we know that feelings and emotions can affect the immune system, we know that talking therapy such as hypnotherapy can affect feelings and emotions. So therefore we take that full circle, and then things like hypnotherapy, talking therapies can actually influence the makeup of the immune system. So that's an experimental area that I get involved in and I research and present on.
That's fascinating. So then when you say you're researching it, what does that look like? Are you standing there with a pad of paper and taking note? Like what, how
I,
do you,
I'm looking. I'm a member of one of the few lay members of the Royal Society of Medicine, so in London. So I get access to a lot of the research documents and papers and stuff like that. So I keep my eye out and I go out regularly and see what I can find. What's the latest research and where's it going and stuff like that.
wow, that's fascinating. That's really, really fascinating. And so if you were to get into a like a preventative kind of mode, are you also sort of I know we can't prevent a disease, and again,
Yeah.
that's maybe treating the disease, and I'm not asking you to cross a line. I'm just curious, are there sort of protocols or things that you suggest that people incorporate into their lives that you've learned in your research?
Yeah, no, I mean, well, certainly as far as sort of psychoneuroimmunology is concerned, probably the best thing there is to keep yourself, if you like, sort of stabilized, if you like, because areas such as anxiety and depression and things like that down-regulate the immune system. So then you're more prone to catching colds or catching other illnesses, sort of various tract illnesses and things like that because your immune system's compromised. Now there is arguments on that front that if you have a very compromised immune system, can that leave the door open for things like cancer, for example? So again, the idea is, keep your immune system as powerful as you can, whether that's through eating the right things, vitamins and eating the right things and so on, and obviously keeping the mind in the right place, which is where hypnotherapy can come in, deal with the anxieties, the stresses and so on. Even if it's not using hypnotherapy, even if it's just meditation, guided visualization and your own meditations and self-hypnosis and stuff.
Fascinating, Jen.
Well,
Go ahead.
I mean, you may have answered this already in the fact that when is a hypnotherapist brought in? Because I'm just thinking about the power of the mind. And I've also known from friends of mine, they've actually told me they've healed themselves. So I'm just wondering about bringing the hypnotherapist in initially almost to see where that goes.
Yeah, I mean that I probably do more privately than through the NHS because the NHS obviously are very strict guidelines of what we
Yeah,
can do
for
and can't
sure.
do. And again, because of the Cancer Act, no, we're not even allowed to say that we can work with it. But again, if people approach me privately, again, I will use the same thing. Say, well, the 1939 Cancer Act says that we're not allowed to, but yes, there are spontaneous remissions and so on. The scientific evidence isn't there to prove it, but as long as we're doing it for your psychological well-being, this, I'm more than happy to do it, and we'll see where it goes. Now, obviously, that doesn't tend to happen in the hospital environment because you're just there for them going through the journey of the cancer journey. So it would be at one point where if they've got a particular problem, their surgeon or the oncologist will say, oh, have you thought of hypnotherapy? That might be a benefit to you. So that is really more later in the game. But whereas I do get some people that are very much into complementary and alternative medicines that will come to me privately from the outset and say, right, can we do this? And we do. Obviously, again, it's done experimentally, and it's got to be done on the basis that it's only for the psychological well-being.
Well, I'm all about giving people hope. So
Yeah.
could you share with us maybe one or two examples of something that's happened that maybe people can leave this feeling hopeful, and if they're in a situation that might require?
Yeah, I think one of the cases. I mean, I've got some quite sad cases, unfortunately, but so I've got some really good ones. I think probably the one that springs to mind more than anything was I saw a lady in hospital. I think she was around 28, 29. She had a very active lifestyle. She was into parachuting and all sorts of other stuff, dangerous sports, and very, very active. She'd been diagnosed with colon cancer and was told that it was hadn't spread very much. It was a bit of keyhole surgery, and she'd be able to carry on pretty much as normal. Now, when they opened her up, they found that it had spread significantly and it hadn't appeared on the scans. So they decided while she was on the operating table that they need to remove it all. So they removed most of her colon rather than keyhole surgery. To get in, they had to break all her ribs on one side to get in. Took a lot out. She had a colostomy and all sorts of other stuff. Obviously, when she was brought back round, she was in severe pain, severe shock. Wasn't what she was expecting. Because it had spread so much, they said that she needed heavy duty chemotherapy. That reacted with her, and she died twice through that and had to be resuscitated. And that's when I saw her for the first time. I was brought to her bedside. She couldn't sleep. She was in severe pain, severe shock, anxiety, and all sorts of other things. So I started working with her as an inpatient, dealing with the pain, dealing with the sleep, dealing with the all the shock and everything else. Then she got well enough to sort of see me as an outpatient. She was coming in. We were doing a lot of work together, and carried on. She improved and improved. And I saw her again a couple of years ago. She came to see me as a private patient for sports performance. She wanted me to assist her with her triathlon performances.
Wow.
Nice.
Yeah. So I thought that's probably the best one.
Awesome. What a great message.
Yeah.
So I know that Dan has told me that you do parts work. Is there anything else, particular modalities or ways of doing things that you could share with us?
I do a bit of all sorts. I mean, I will work with the person in front of me, and having done a master's degree, I had to learn all sorts of different ways. So I've had to learn EMDR. I've had to spend months doing CBT and EFT and everything. So I know sort of the majority of modalities, all the different types of hypnotherapy. I would say analytical hypnotherapy is my sort of favourite. I find that's more powerful. And I do particularly like parts work. I find that very powerful, except that I don't do parts work how a lot of people would consider it traditionally done, and that was really brought on through the hospital environment, because I find a lot of parts work, you can have a lot of parts involved. It can be very time consuming. It can be very confusing because you're going off in all sorts of different directions and parts negotiation and so on. So I actually came across a version of doing parts by a lady called Valerie Austin, who's British but now lives in the States, and she's pretty much retired. And I've sort of moved what she did forward. And my version of parts work, it's a combination between parts and ego state therapy, but it's done in a very authoritarian manner. So and the key to it really is in the pre-talk. And if you get the pre-talk right, you know exactly where the session is going to go. It means that the patient doesn't get any wriggle room. They're going to go in this direction and no other. You know how you're going to deal with the parts. You know how you're going to deal with any sort of failures of trying to prove stuff with them, and you know exactly how long it's going to take. So to me, that's the most powerful technique that I do.
I'm just wondering about the analytical hypnosis. When you say that, what do
Mm.
you mean by that?
Analytical. Well, over here, and I guess it's the same in other countries. We have a lot of people seem to be doing what we call solution-focused hypnotherapy, and solution-focused over here seems to be basically just suggestion and nothing else. I've got into awful trouble before when somebody said to me, "Oh, what's your opinion on solution-focused hypnotherapy?" And I said, "Well, it's hypnotherapy with the useful bits taken out." But because to me, it's just pure suggestion. I mean, yes, it's very powerful with the right clients and the right patients, but to me, pure solution focus is just post-hypnotic suggestion. Whereas things like parts therapy, you're finding out which parts, you're analysing which parts of the unconscious, for want of a better word. Okay, we know the model's changed and there's no such thing, it's now the non-conscious and so on. But looking for the part or parts that might be causing the problem or impacting the person. And even things with phobias, for example, the old-fashioned thing of regression to cause, find out what the causes and the triggers were. So to me, I find that far more powerful to hit it from every side. So I would hit it from the suggestion side, the analytical side. I would also introduce NLP to it as well, because I find that's very powerful to augment it with, and just hit things from all different sides. So that's the way that I pretty much work.
Very thorough. Very
Yeah,
thorough.
yeah.
You're leaving no stone unturned. That's probably from your research background, right?
I think
You
yeah,
want
I think it is. Coming from the computer background, everything's very logical and thought out, and that's the way I go.
well, people are benefiting from your
Yeah.
thorough. So we all thank you for your work.
Well, thank you.
And with that, that brings us to our next segment,
Hmm.
which is our silly subconscious question.
Right.
And our question for you today, Gary, is if you could take any object and shrink it down to carry it in your pocket, what would it be?
Oh, that's an interesting one. Does it get bigger again when I take it out, or does it have to stay small?
I don't know.
Big
Yeah.
question.
You tell you
One
tell
of my
us.
Yeah, I mean, one of my hobbies is I love music. I love rock music, but I love playing it as well. I play bass in a occasionally I play bass in a rock band, 80s metal band, and so probably a bass guitar and amp if I could carry it around with me all the time.
I love
Nice.
it. Well, that goes right into our beyond question. Beyond what we've spoken of today, is there something else that you could share with us about something that you lights you up, that you enjoy?
Yeah, I mean, I sort of get involved in all sorts of things. Yeah, I mean, my big passion is music, rock music. So I go to a lot of gigs, and I play it. Another thing that goes along with that in the UK is, as you know, we have a very good pub culture in the UK, and we like our beer. One of the things that we do have in the UK is we have a lot of beer festivals, and we have some things each year, sort of, if you like, beer judging. There's competitions where there's a champion beer of Britain in the year and things. And I go to a lot of festivals, but I actually did a full-on training course, and I'm a qualified beer judge for that. So I do that,
Nice.
and I also scuba dive. So lots of varied things. So musician, scuba diver, and qualified beer judge.
Wow. And if you could
Nice.
Not all at
only
the same
and
time.
if you could only have one type of beer for the rest of your life, what would it be?
Yeah, what would it be?
I like real ales, sort of
Okay.
English real ales. But it
Yeah.
would probably be what we call a porter, which is a sort of a dark winter beer.
Yes,
Mhm.
something to sit by the fire.
Yeah, yeah.
Yeah.
Very nice. Wow. I love it. Well, thank you so much for spending time with us today, and
Thank
we
you
hope
for
you'll
inviting
come
me.
back. And Jen, with that, what do we always say?
Peace out.
Peace out.
Cool.